welcome to the recorded version of the spine class hosted by Natalie. I'm the nurse navigator of the ERAS program at Neurosurgery 1, part of Common Spirit. Thank you for being here with the class. We are going to go over the PowerPoint that is located in your folders that you received in clinic or it was shipped out to you. And the PowerPoint, if you can see this first slide, that is what the beginning of the PowerPoint looks like. If you want to follow along with that PowerPoint as we go through it, and we will go through all of the content, and there are some pieces of paper in the folder that I will reference as well, as they are written really tiny in the PowerPoint. So welcome to the ERAS class. The more educated that you are before surgery, the better your outcomes are going to be after your procedure. So be your best advocate. Please let us know either by calling our Neurosurgery 1 office. If you have any questions, you don't understand anything, please let us know. Our goal is to help make you feel the most confident that you can be before going into your spinal procedure. Our ultimate goal is to make this process as seamless as possible and get you back on your feet and getting able to do what you love in life. Thank you for choosing one of our Common Spirit facilities. You should see where you're having surgery on this list. We operate out of our major hospitals, St. Anthony's, Ortho, Colorado, St. Anthony's North, and then we have two standalone surgery centers, South Denver Surgical Center and Functional Neurosurgery Ambulatory Surgery Center. So our spinal surgeons operate out of any of these facilities. Our agenda of this class today is we're going to go over what is ERAS. ERAS stands for the Enhanced Recovery After Surgery. We'll do a little bit of a spine overview, a little anatomy, getting you familiar with the structures, some pre-surgical, surgical, and post-surgical expectations, what you'll see in each of those phases. We'll talk about pain management, more specifically our multimodal pain approach to help with discomfort after surgery. We'll get you familiar with some equipment that you will see in the hospital and afterwards for when you're getting home. We'll talk about rehabilitation, so getting you back on your feet, helping with your recovery process, things that you can do to prepare your home before your surgery. So the more prepared that you are before surgery, the easier that transition will be after surgery, and everyone's favorite discharge, so getting out of the hospital. So a little bit about ERAS. It's been around since the late 1990s, started over in Denmark. Since it's moved its way to the States, it's been with our colorectal surgeries, and then it's been with our Neurosurgery 1 spinal surgeries for about 4 years. And our surgeons love kind of the outcomes. The patients have a good experience, overall understanding of kind of what to see in each of those phases regarding getting you prepped and ready for your procedure. So what is ERAS? ERAS, or the Enhanced Recovery After Surgery, it's an evidence-based practice protocol. It focuses on reducing any post-operative complications, overall improving patient outcomes after surgery, getting you out of the hospital sooner, so decreasing your length of stay, and improving the overall patient experience. So the key principles of our ERAS program are the carb loading, so those Ensure drinks that you got, the sugarless candy, infection prevention, and the multimodal pain approach, and early mobility. So you can see in this picture the tote bag that you received. You only need the folder for this spine class. The other supplies will come into place before surgery, and then the candy is after surgery. So the ERAS supplies. So the first of your supplies are the Ensure pre-surgical clear carbohydrate drink. Depending on your medical history and one of the labs that we had you draw, the A1C, is how we're determining what type of carbohydrate load that you are. And so we have 3 different types of carbohydrate loads. We have a regular carbohydrate load. Those received 3 bottles for regular. We have a moderate carbohydrate load where you received 2 bottles, and a no carbohydrate load. So you are skipping this portion of the ERAS program. So these Ensure drinks are really beneficial. Each of them contain 50 grams of complex carbohydrates in them. And so when you are drinking these before surgery, whatever your body isn't using as natural glucose, natural sugar, energy, it stores in your liver is what's called glycogen. And glycogen is important so that when your body is under stress or having the anesthesia, we have a sugar source to pull from. And so instead of depleting what's just naturally running through your body, it helps maintain your blood sugars levels during times of the stress like the anesthesia. These drinks are also important. They help curb your hunger and your thirst. So as you're fasting before surgery, helps take that edge off. And it also helps prevent any post-operative nausea or vomiting that no one wants to experience. And so lots of good benefits. These drinks do taste better if they are chilled or on ice. And so they are pretty tasty going into your procedure. The next one are our CHG wipes or the chlorhexidine wipes. You should have received 2 packages of these wipes because we are going to do a pre-surgical scrub the night before surgery and the morning of your surgery to help get any of the bacteria that just naturally lives on our skin. So these wipes have a lot of antimicrobial properties in them, and they help just prevent any infection or more than just where your incision is going to be. And so this is a nice way to get a pre-surgical wash to help minimize any complications. The next one, the funnest one on this list, is our sugarless candy. The sugarless candy comes into play after surgery. So when you have surgery and you get the anesthesia, everything in your body goes to sleep. And our GI system, our intestines, our stomach, that's usually the last system that wakes up. And so the idea behind this candy is when you are taking these in after surgery, it increases your saliva production, which helps wake up our GI tract. So we don't want any constipation, any post-op ileus or bowel obstruction. So this kickstarts the GI paralysis, so moving around of your intestines. And so we do the sugarless candy regardless if you're diabetic or not, because some of the components kind of irritate our GI system, which is what we want. We want to get it kickstarted after we get the anesthesia. So if you want to pull out this packet in your folder, it should be on the right-hand side. It's titled ERAS, the Enhanced Recovery After Surgery, and then it has the preoperative spine class right there in the middle. So it looks like what it is on my screen. So this is probably your most important packet that you got within your folder. This has a lot of instructions before surgery, after surgery, and it's a really good info for anything that you need surrounding your procedure. So on the top there, you see what type of carbohydrate load that you are. So the 3 types, the regular, moderate, or no carbohydrate load. So take a look, see which one that you are, and this will be beneficial for the quantity and when you're going to be drinking those Ensures. I want to point out our Neurosurgery One office number that's on the bottom of this screen. This number is a 24/7 service. We have providers that are on call. And so if you have a question Saturday morning and our office is closed, give this number a call and we can make sure that your needs are getting addressed timely before or especially after your procedure. So you don't have to wait till our office opens. Someone will be at the other end of the line to get your needs addressed. So flipping over, these are all of your pre-operative surgery instructions. At the top there, you'll see what type of carbohydrate load that you are. Everyone needs to arrive to their surgery center 2 hours before your surgery start time. There's things that you can do to prepare going into surgery. So starting a couple days or a week before surgery, I want you to increase your hydration, so extra water on board. Try to shoot for at least 8 to 10 glasses of water, juice, milk, or Gatorade, anything before surgery. The reason behind this is the anesthesia that you're going to be getting for surgery. The way that it gets out of our system afterwards is through our kidneys. And our kidneys are very dependent on how much water we have in our system. So being extra hydrated will help with this. It's also going to help with your nurse to start an IV on you in pre-op. So a lot of good reasons to increase your water intake. But please reduce your caffeine or alcoholic beverages as those tend to be dehydrating agents. Leading up to surgery, let us know if you have any signs of an illness, any cold, fever, sore throat, diarrhea, or any COVID symptoms. We want to make sure the timing for your procedure is appropriate if you have any kind of sickness. And then everyone needs to make arrangements for how they're getting to and from the hospital. You will not be allowed to drive yourself home after receiving anesthesia, so start making those preparations now. A week before surgery, so while you're increasing your water intake, I also want you to increase your protein intake as well by about 2 to 3 servings a day. So that can be anything: meats, nuts, dairy products, protein shakes. Protein is important. It's made up of amino acids, and amino acids are what's going to help your incision to heal nicely after surgery. So increasing that will help. It's also going to help, so as you're getting your appetite back after your procedure, you'll have some extra nutrients on board beforehand to help with this process. If you don't already have your stool softener of choice, then I want you to pick up a stool softener. There's a lot of different kinds out there: Miralax, Colace, Docusate, Senna. If you've had constipation in the past, then I want you to start taking these stool softeners a couple days before surgery, just in preparation for the anesthesia, slowing all of our body systems down, and we want to prevent constipation for after surgery. If you've never taken a stool softener before, then I would recommend a Colace to start with. It's a nice kind of gentle stool softener that you can start taking those couple days before surgery. Prepare some meal plans, arrange for animals care if needed, and then pack your hospital bag. Our PAT department will go over all of the things to bring for surgery and things to leave at home. Main thing is bringing your phone charger. If you're staying overnight, bringing some comfortable clothes, some pajamas, some non-slip shoes, any toiletries, and then this is where your sugar-free gum or candy is going to go in your hospital bag so that you can start using this after surgery. So a day and the night before surgery, this is where those Ensure drinks are going to come into play. So if you are a regular carbohydrate load, you're going to drink a total of 2 bottles of these Ensures the day before surgery. I like to break it up because it is a lot of liquid. So maybe drinking one the morning of surgery and the night before surgery, but it is up to you. If you'd rather just drink them all at the same time, that's fine too. If you're a moderate carbohydrate load, you're going to drink a total of 1 of those Ensures the day before surgery. Again, you can break this up as it's a lot of liquid, so the morning of surgery or morning up before surgery and the night before surgery will help kind of split that up. If you started taking those stool softeners, you'll continue those. And then I want everyone to change their sheets and their pillowcases. This will help with the infection prevention going into surgery, because you're going to take a shower and use the first package of your CHG wipes to clean around your surgical area. On the next slide, we'll talk about how to use those CHG wipes. You'll get a good night's rest as much as you can. You'll stop taking the medications as instructed by either our team or the doctor who's providing you clearance. A lot of those medicines to hold before surgery are blood pressure medications. And then starting at midnight before your surgery, this is when you're going to stop eating all solid foods. So this is the first phase of the fasting period going into surgery. So no more meals at this time. You can continue to drink clear liquids. So anything that you hold up to the light and you can see through, you can continue that up until 4 hours before surgery. So that's water, apple juice, Sprite, black coffee or tea. You can continue that till a little bit closer, but midnight is your cutoff for all solid foods. So no more gum or candy at this point either. We're trying to get in preparation for the anesthesia. The morning of your surgery, you are going to shower and you're going to use your second package of your CHG wipes to clean around your surgical area. You'll put on some clean, comfy clothes, whatever you're wearing into surgery. Don't put any makeup on, any lotions, oils, creams, perfumes, and that you can wear deodorant. Sometimes it's easier just to go in your natural self as you're heading into surgery. And then 4 hours before your surgery start time, this is when you're going to drink the last of your Ensure. This one, we do recommend to drink this relatively quickly just so you can optimize the full 4 hours of the fasting. And then you'll stop all clear liquids at this time. So no more water, no more coffee, anything at that time. You want to be completely fasting at this 4-hour cutoff before surgery. Flipping over to the next page, I like this one. It kind of breaks down when you are drinking those Ensures. So if it helps you to make 3 check boxes for the 3 different times you're going to be drinking them, I like check boxes, so that would help me out. So the day before, you're going to drink 2 bottles if you're a regular carbohydrate load, 1 bottle if you're a moderate carbohydrate load. And then the day of your surgery, so 4 hours before your surgery starts, you're going to drink the last bottle or last half bottle, and drink that one down quickly. So if you are a moderate carbohydrate load, there will be a half of a bottle that goes to waste that you will not need before surgery. And again, if you're a no carbohydrate load, you get to skip all of this ensure step going into your procedure. So infection prevention, so the CHG wipes, how you are going to use these is you're going to take a shower, nothing special about the shower that you're going to take, but you are going to use a clean towel to dry off completely. When your skin is completely dry, you'll open up the package of the CHG wipes and you will scrub your surgical site for a full 3 minutes. It says using a back and forth motion. You can do circles, whatever you'd like to do. But the 3 minutes is key to make sure that you get all of the good properties of these wipes. And then you don't rinse these off. You will just put on your clean set of pajamas or clean clothes for the morning of your surgery. And then just being aware that everything that you just cleaned, making sure you're not putting anything on that, including your hands, just because you want the good properties of these wipes to get into your area. I do want you to avoid your face, your head, genital area, any open areas of skin, cuts, scrapes. We want you to avoid that. These wipes are pretty well tolerated by a variety of skin sensitivities, but we just want you to avoid those open areas. If you are having surgery at Ortho Colorado, you can skip the morning portion of this wash. You will do your own CHG wipe when you come into the preoperative area of Ortho Colorado. So if I'm getting surgery on if I'm getting an ACDF or an anterior approach to my cervical spine, my incision is going to be right at the base of my neck. And so what I'm going to want to clean is all the way up to my jawline. I want to go on the top of my shoulders, kind of all the way around my neck, on the top of my chest. So it's more than just the area of where your incision is going to be. It's all that surrounding skin. We want to get all of the surrounding skin with these wipes. Now, if I'm getting surgery on my back, my thoracic, or any kind of posterior surgery, this might be a little bit difficult to reach. And so having your caregiver help you out will be helpful in making sure that they're using the full 3 minutes. So set a timer, play your favorite song. The 3 minutes is key for these wipes to get all of the good properties. So then flipping over, these are some general medications that we want you to hold a week before surgery. This is not a comprehensive list. There are other medications that we want you to hold a week beforehand, but this list has different types of vitamins, supplements, and different types of NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs. So those are things like Advil, ibuprofen, Motrin. We want all of these medicines out of your system because they can interact with your blood clotting levels or interact with the anesthesia that you're going to be getting. So we want these out of your system. And then on the bottom, there are different types of anticoagulants or blood thinners. You should have specific instructions by the doctor who prescribes those or by our team of when you're going to hold those before surgery. Sometimes it's a week, sometimes it's less. And so please follow those specific instructions by your doctor. You can continue Tylenol or pain medications before surgery if you are taking those. Just make sure they don't have any type of NSAID properties to them. Flipping over the spine surgery, these are all of your post-operative instructions. And so on the top there is incision care. So you can shower the day after you discharge from the hospital. You can wash with soap, water, even soapy water, run on your incision. But I do want you to blot your incision dry, and I don't want you to submerge your incision. So no baths, pools, bodies of water until that incision is completely closed. So whether that's 2 weeks out or a little bit longer, no submerging your incision. If you are instructed to keep a dressing over your incision, I want you or your caregiver to be changing it daily and making note if there are any changes to your incision. So please see if there's any changes and give us a call and making sure that it's getting changed every day. Our surgeons use a variety of different closure devices for your skin. like Dermabond, which is a medical super glue. Those will just absorb and stay on their own. Same thing with what's called steri strips. Steri strips are like a medical grade butterfly bandage. So those are really strong and they stay on until they come off on their own. So nothing that you will be pulling off. I don't want you to put anything on your incision, no topical ointment, lotions, until you're cleared, until the incision's fully healed. Same thing with those steri strips. Leave them on until they fall off or they'll be removed when you come back into the office for your post-operative appointment. If you have staples or sutures, those will come out at your post-operative appointment as well. The next one, pain management. Prescription for pain medications, those will be provided to you before you leave the hospital. You can get them filled at the hospital. When you're taking the pain medication, I don't want you to take marijuana or alcohol because those can increase your sleepiness levels. And so please avoid that when you're taking narcotics. And then we'll have two kind of classes of medications. We will have scheduled medications, and we want you to reserve the opioids just for breakthrough pain medication. We have a whole slide talking about pain, so we'll get into it there. When to call our office, we do want to know if there's any changes to your incision, any redness, swelling, pain at your incision site, if there's any signs of your incision separating, any continued drainage from your incision, if you have any new or worsening neurological symptoms, so weakness, numbness, tingling, if you have a fever greater than 101.5, and then any questions or concerns, that's what we're here for, to help make sure that those needs are getting addressed. Things to seek emergent care for, we want to rule out any of the big things. And so if you have any severe swelling and or pain in your arms or legs, chest pain, shortness of breath, we want you to go to the emergency department. And if you have new uncontrolled bowel or bladder movements, because we are having spinal surgery, that is a sensitive area. We want to make sure that if you have new loss of your bowel or bladder, you are going to the emergency department. Medications. So taking an over-the-counter stool softener is going to be helpful after surgery as well. Here's a list of different types of those constipation medications. So if you've been more than 4 days without a bowel movement, give our office a call. We can try other medications or methods. We want to make sure you're having normal bowel movements after your procedure. Before you leave the hospital, we'll talk about resuming any of your prescription medications, especially your blood thinners. Before you leave, those you should have specific instructions of when to resume those. The next is everyone's going to get a prescription to what's called Celebrex. Celebrex is a type of NSAID, and so I want you to take Celebrex or your over-the-counter NSAID of choice. Just don't take both of them together. They are in the same class of medications, so pick one or the other, just not both. And then here are different examples of those NSAIDs, so the Motrin, ibuprofen, things like that. Next are your activity precautions. So the spinal precautions are no bending, no lifting, no twisting. These are strict until at least your post-operative appointment, if not longer. So bending, that's anything greater than counter height. Lifting, that's anything greater than 10 pounds or about a gallon of milk. And twisting, that's anything that's moving your top half from your bottom half. So yes, we're taking away your BLTs, but I want to make sure you're walking at least 3 to 4 times a day after surgery. That's going to promote your incision to heal nicely, prevent constipation, and it's going to help your overall recovery process. If you are taking the opioids, I want you to avoid driving. Typically, driving restrictions are about for 2 weeks or until you can safely check your blind spot. And if a brace is ordered for you, we will get you fitted for it. We will provide it for you. I don't want you to go out and buy any kind of braces. These will be provided to you based if your surgery needs it by your surgeon. Next is diet. So you can resume a normal diet after you discharge from the hospital. I would encourage some protein, high fiber foods, fruits, vegetables, whole grains. There is a pamphlet in your folder on the left-hand side about My Plate. My Plate is a good tool to make sure that you are having a well-balanced diet. You're getting all of those essential nutrients to help with your overall incision healing. So take a look at this. If you've had surgery in the past and it's maybe taken you a bit longer to get your appetite back, then it wouldn't be a bad idea to pick up some protein shakes, some supplements, just to make sure that you're getting all those good nutrients. And then you should also see a coupon in your folder for what's called Juven. Juven is a supplement that helps promote wound healing. It's a great supplement. And so there's a coupon in there. If you want to pick it up at either of the hospitals, they offer a pretty good discount with that coupon. If you're further away than using Amazon, Walgreens, they have the Juven as well. And it's our recommendation that you take it 7 days before surgery, 7 days afterwards to make sure everything's healing nicely. This is an out-of-pocket expense, but it is recommended by our team. The last one on here is do not smoke. So smoking or any other kinds of tobacco can decrease the chances of your fusion from mending your bones together, and it can impair your incision to heal. And so if you are a smoker, if you have any motivation to quit, now before surgery is the best time to do it. We have some resources for you if you would like for quitting smoking before surgery. Then on the bottom there, you see our neurosurgery one office number. And so this is a good, again, to have it handy. My recommendation is putting this whole packet on your fridge or having it somewhere accessible so that you can reference it before and after surgery. We are going back to the PowerPoint. We are on slide 10. These are different incision closures that our surgeons use to close your area. The first one are stitches, and then we have staples. Those will be removed when you come back for your post-operative appointment. And then these are those steri strips, so those kind of medical grade butterfly bandages. Those just fall off on their own. The picture on the right is what those steri strips look like on a person. So they kind of have the brown tinge to it just based on the iodine that they use during the procedure. So this is a good looking incision, good looking picture of what those steri strips look like. And again, those just stay on. You do not take those off. Commonly, they use the steri strips with Dermabond, so that medical super glue. And so those just dissolve and come off on their own. So then I want you to pull out the paper in your folder. Should be on the right-hand side. It has the maroon heading. It says pain, a well-rounded approach. It's written really tiny in the PowerPoint, so go ahead and pull out the big paper. So on the first page, it has different alternative interventions for pain. These are helpful because they have nothing to do with a pain medication. They are all interventions, and these are helpful. The first two especially, so being mobile, walking around in ice. Ice is super helpful because it helps shrink all of the cells around that area. So alternating, having 20 minutes on of the ice, 20 minutes off is helpful to take away some of that pain around your surgical site. And then take a look at the rest of this list, see if there's anything that sticks out to you. It's a great distraction technique from your pain. These are also helpful, so as you are taking pain medications, those can take 45 minutes or so to get into your system. So having kind of some alternative interventions are helpful to pass the time. These are also helpful as you're weaning off the pain medications to help distract. They do work better than you think. This is super helpful for any discomfort after your procedure. So then flipping over at the top there, you see our pain scale. So if you've ever been to the doctors or hospital, you've been asked, what is your pain on a scale of 0 to 10? 10 being the highest pain you've ever had. So mauled by a bear or childbirth, whoever uses their examples. And so I want you to have an understanding of where your pain is at before surgery, and then setting a realistic goal for yourself for where you'd like to be after surgery. So if you're living out of 8 out of 10 of pain, then it's unrealistic. We're going to get you down to a 0 after surgery. There is some time for recovery. And so setting a good goal for yourself, like if I'm at an 8 out of 10 before surgery, I'd like to get to a 5 or a 6. We're still moving in the right direction, and it won't discourage you if your pain isn't all the way down to 0 immediately after. And then take a look at the other things on this list. It's helpful to have some other techniques to manage your pain. The main thing is if you are taking pain medication, then I want you to take a stool softener with it. Pain medication, the main side effect is constipation. And so when I was working inpatient, I would give a pain medication and a stool softener with it to try to counteract each other. Walking around also helps avoid that constipation, having good fluid intake, your diet, and those candies that we got you. So a lot of good information about your pain control. And so I recommend just taking this to the hospital, as you're kind of weaning yourself off pain medications, you're helping manage your discomfort. There's a lot of good techniques in here. Then back in the PowerPoint is where the rest of this information is written. So the non-medication techniques, so the frequent short walks, repositioning yourself often. I don't know about you, but if I'm in pain, I tend to just not move, try not to make the pain worse. But after your procedure, if you're not moving around, then your muscles are going to get cramped up and tightened, and it's going to be uncomfortable. So even if it is painful, still making even micro adjustments so that you are not getting kind of locked up. Distraction techniques, all while maintaining your spinal precautions. So those BLTs, avoiding constipation. These are kind of our different classes of the medications that you're going to see after surgery. So the first ones are scheduled pain medications. So these will be brought to you by your team, the nursing team, around the clock. The first one is Tylenol, and Tylenol is important. We do an extra strength Tylenol. So it's about 1,000 milligrams every 8 hours or so. Tylenol is great for helping your inflammatory processes in pain, but it also acts as sort of a helper medication in conjunction to the other medications. So if you take Tylenol by itself, great, but if you add Tylenol with muscle relaxer or another type of medication, Tylenol makes the other medicines work better. And so that's a fun fact about Tylenol. Not a lot of people know. So that one taking around the clock is going to be super beneficial. The muscle relaxers, it's typically Robaxin or a Flexrel you might see. That will be given around the clock as well. Muscle relaxers are important because we have a lot of strong muscles that are supporting our spine. And so those get kind of irritated just as the nature of the surgery. And so taking those muscle relaxers will help relieve those cells, help with any kind of cramping pain. I would say most of postoperative pain is related to your muscles. The next one are anti-inflammatories, so Celebrex or Toradol. These are great medications because these help calm your inflammatory processes within your body. I would say the underlying cause of pain is inflammation, just related to the nature of the surgery. Your body sends its kind of fight or defense mechanisms when there's something new going on. So if you scrape your leg, they send those inflammatory processes. You might have swelling over there. And so same thing with surgery. It's going to help calm those cells down and help with the inflammation. And the steroids work very similar to that. So the Decadron or a Medrol dose pack, those are also helpful for helping with the inflammation related to the surgery. I will say a lot of the inflammation does go down over time after surgery, and so these medications really do help with that process. The next one are nerve pain medications, so gabapentin or Lyrica. These medications are helpful for if you're experiencing symptoms like numbness, tingling, pins and needles. These are helpful to combat those types of symptoms. If you're already on these medications, you'll continue those out throughout your surgical journey. But because of the inflammation that surrounds your surgical area, some of those nerves get pinched off, and so that's why we have those symptoms. So all of these scheduled pain medications, they all target different receptors of our body, different pain receptors. And so when you're experiencing pain, it's nice to get a medicine that targets those specific receptors. Opioids do not target those specific receptors. It's more of, I call it like an umbrella type of pain medication. It's not specific to a nerve pain medication, not specific to a muscle relaxer medication. It's more of that kind of umbrella to get you that pain control. So that's why we want you to take the scheduled medications along with those alternative interventions for pain on that page. And then if you're still having discomfort, that is when the opioid, like an oxycodone, the Dilaudid inpatient, that's when those medications are going to be beneficial. So after you've tried all of these scheduled medications. Another medication you might hear about is called methadone. Methadone is a type of opioid that can give you up to 72 hours of pain control. This is a medicine that we give in the operating room. Not everyone qualifies for methadone. You have to be inpatient for at least one night, and it is surgeon and anesthesiologist preference. So not everyone will get methadone, but it is a medication. If you happen to hear about it, it is just a longer acting pain control. So when you're at home, this is a lot to keep up with. When you're in the hospital, your nurses will keep up with when's the last time you had this medication? When's the next time you can have this medication? But when you're at home, this is a big adjustment. And so in your folder, we have a medication log that I do recommend you fill out, and you use this as much as you can for at least the first couple of days surrounding surgery, because the different medications, it's a lot to keep up with. And so this is a nice way to make sure it's all in one place and you can manage your medications for when you're at home. So different types of spine conditions. This is our little anatomy lesson. And so the first one, I just wanted to show all of those big, strong muscles that are supporting our spine. So we have all of our back muscles, our neck muscles, our abdomen muscles, and so they just get a little disrupted having surgery. My best kind of analogy of why muscle relaxers are helpful. So if you think of your spine right now as a loose rope, and so that is caused by aging, trauma, any kind of injuries to your spine, that rope tends to become loose. And so when your physician goes in for surgery, they're tightening that rope again. So that's why the muscle relaxers are so important. Your muscles may be taking on more of the load again, and they need time to adjust. And so it is our recommendation that you take those muscle relaxers for about 2 weeks after surgery. This should be your first line for the pain management portion for your discomfort after surgery. The next picture is looking a little close up on the spine. So you can see the bones of our spine called the vertebrae. And then we have the disc, our intervertebral disc in between the bones of our spine that helps give us kind of the support and helps absorb shock, absorbs pressure. I like to point out where those spinal nerves are. So you can see how close they are in relationship to the rest of our structures. So that's why the pain medication or the nerve pain medication like the gabapentin is helpful, because as things are a little swollen back there after surgery, our nerves get a little pinched off. And so that's why that medication is going to be helpful, along with the anti-inflammatories to relieve that pressure. The picture on the right, these are different kind of analogies of different conditions that we can get to our spine. So the top there, you see a normal looking disc. So there's a lot of surface area in between the bones or vertebrae of our spine. As we work our way down, we have degenerative discs. So this is after age, trauma, injury. So you can see there's a little disruption between the surface area of that disc. We have a bulging or a herniated disc. So you can see that disc is slipping out of place just a little bit. We have a thinning disc, so less of that surface area between our bones. And then we have disc degeneration with osteophyte formation. Those are types of bone spurs that we can have. And so our surgeon is looking at all of your imaging. So your CT scans, your MRIs, your x-rays, and they're listening to what type of symptoms that you have. And that's how they're determining what type of surgery is going to be the best and the most beneficial for your case. And so it's just nice. There's no anatomy tests in order to have surgery, but it's nice to understand kind of the structures and the relationship between the bones and the discs and the nerves and kind of what can happen, what can kind of disrupt those structures. And so it's just kind of helpful to get a basic understanding of the structures. The next one is a sacroiliac joint fusion. This is a type of surgery that helps add stability into our pelvis. Our pelvis is a good foundation for the rest of our spine. And so this helps add that stability. They're placed across the joint. It helps encourage your bone growth, and it essentially eliminates movement by the SI joint by grafting together the ilium, the sacrum, the pieces of our pelvis. And so I talk about bones and discs and nerves and all of that, but we also do this surgery to help add support to the rest of our structures. So infection prevention. So there's a lot of things that you can do to help minimize your risk of a surgical site infection on top of using those CHG wipes. And so having clean sheets the night prior to surgery, this is important. So as you're using those CHG wipes, you ensure that all of that area is clean as can be going into surgery. I also think this is a good idea for after surgery as well, just to make sure that there's no any new bacteria that could be going into your surgical site. Using a clean towel or washcloth after you shower using your CHG wipes. This is important, again, to not expose any new bacteria. No shaving around your surgical site for 1 week prior to surgery. So shaving can cause little nicks or little cuts. No matter how good the razor is, it can cause those little cuts and could increase your risk for an infection. And so your surgeon will shave whatever they need to in the operating room. I just want you to avoid shaving around your surgical site for a week prior. No pets in the night before or after surgery in your bed. I know this is the saddest one on the list. If you can try to avoid your pets being in bed, this is important, especially around your surgical site, because we love our four-legged friends, but they carry any kinds of bacteria, dirt, germs, and so making sure that they are not exposing your surgical site to any infection. Under pads on the sheets, this is more applicable for when you're in the hospital. They use Chuck's pads, or they're like a moisture wicking absorbent pad. And these are nice because every time that you get up out of bed in the hospital, they can get a fresh one on there. And it's nice to have a clean surface so you can know if there's any drainage coming from your incision. It's not something that you need to go and buy for when you're at home. I think it's just helpful to understand when they're in the hospital. Using clean pajamas every night after surgery is important because pajamas are probably going to be the first contact to your incision. So making sure they are clean as can be will help not expose any bacteria. And then diligent oral care is important. Our mouth is very vasculature. There's a lot of blood vessels that are in our mouth. And so that is the first line to the rest of our body. And so making sure we have good oral hygiene is important. And if you have any dental procedures coming up before surgery, I want to know about. Some of our surgeons are very particular of what type of dental work is approved before surgery. Our typical rule is avoiding dental work 6 weeks before and 6 weeks after surgery. So let the team know if you have any dental work coming up. So when you arrive for the hospital, you are going to arrive 2 hours before your scheduled surgery start time. You'll check in at the registration desk. You'll be taken to the preoperative area. The preoperative area is when you're going to meet your nurse, meet your team. They'll change you into a gown, start an IV on you. And if you have any last minute questions by your surgeon or the anesthesiologist, this is the time to ask those. I like to put an emphasis on last minute questions because typically on your surgery day, everyone is moving very quickly and efficiently. And so if you have any questions between now and then, that is what I'm here for. That's what your surgical team's here for beforehand, so we can make sure you're getting your needs addressed. You can have one family member sit with you in the preoperative area, and they can get signed up with the text alerts. And so the text alerts are nice at our hospitals. Because your family member can stay up to date with what phase that you are during your procedure. And so if your family member wants to step out, get a bite to eat, they can still be up to date of when you're in the operating room, when they're finished with surgery. And so a lot of good kind of updates at that point. In the preoperative area, you'll be asked a lot of questions, including your name, your birthday, what procedure you're getting. It's not because we don't know the answers, we do, but we want to make sure that it's just part of our safety precautions to make sure everyone's on the same page. They'll also do what's called a timeout in the operating room. And so they'll go over who you are, any special precautions, what surgery, where surgery is. And so it's all part of our safety measures to make sure that everything is getting addressed timely. So the next one after surgery, so you'll be taken to the post-anesthesia care unit. A lot of good things happen in the PACU. The nurse will update your family member. They'll see how your vital signs are looking, manage your pain control, look at your incision, dressing, if you have a surgical drain. and get you repositioned. And so the time in the PACU is very important for how you're waking up and recovering after surgery. If you are staying the night in the hospital, then from the PACU, you will go to your hospital room. And then if you are discharging the same day, then you'll go to a different phase of the PACU. That's where they'll get you dressed, take out your IV, make sure you're walking around okay. And so the time in the PACU does just vary on a lot of factors on how you're waking up, if you are staying the night, if your bed is available on the next floor. And so the time there just varies based on a lot of different factors. In the PACU, if you're waking up good after surgery, typically they'll start to advance your diet. So start you on some ice chips, then clear liquids, jello, broth, juices. Those always taste the best after surgery. And then this is the time where you can start with those sugarless candy to start getting your GI tract moving around after surgery as well. Some equipment that you might see after surgery. The first one are IV fluids. IV fluids will help keep you hydrated before and after your procedure. So as you're fasting before, we still want to make sure your cells are nice and hydrated. Typically, you'll be on these IV fluids until you are able to eat and drink well on your own. This is how you'll get the medications through your IV, the anesthesia, so lots of good things with your IV. The next one are brace. This is a type of lumbar thoracic brace. Again, this will only be provided if it's deemed necessary by your surgical team. We want to make sure you're fitted for it. The next one's a collar. So the collars for cervical surgery, again, only if it is provided for you. I know it might look comfortable, but the collar can actually limit the movement in your shoulders and your neck. And so if it's not recommended for you, then we advise against that if you're recovering from cervical surgery. The next one are drains. So the white one, circular looking one, is a hemovac drain. The next one is a Jackson Pratt drain, a JP drain. Drains are helpful because they help externalize any fluid that is sitting around our surgical site. The drains are completely managed by your healthcare team. It's not something that you're going to go home with. Your only responsibility is to make sure that anywhere that you go, the drain goes with you. So that's why there's the picture of the safety pin on there. We do have those for you. So just making sure if you're going up to the bathroom that your drain is attached to you and is going anywhere that you go. You will not go home with a drain. This will be removed by our surgical team once necessary. The next one on the bottom is a pulse oximeter. The pulse oximeter is a little probe that goes on your finger and it helps measure your oxygen and your heart rate. So these are important. So as you're getting anesthesia, as you're recovering after surgery, we still want to watch your oxygen. It's not uncommon in Colorado to come out with some oxygen on. And so that is just how we are measuring that number. The next one is a Foley catheter. So this is a type of drain that helps empty the urine from your bladder. This will be placed only if your surgery is projected to be 3 hours or more. So more of our longer cases. This just helps contain your urine for in the procedure. And we like to get these catheters out as soon as possible. And so nothing you're going to go home with. We like to get these out so they don't expose us to any new infections as soon as you're recovered. The next one is an incentive spirometer. This is a device that helps with your lungs after surgery. So when we have surgery, we have the breathing tube in. It's doing all of the work for our lungs for us. But after the breathing tube is removed, after we're recovering, our lungs tend to get a little lazy. So by having an incentive spirometer, it helps force deep breaths, helps open up the bottom parts of our lungs, our alveoli, little air pockets, and this helps prevent pneumonia. And so also when we're taking pain medication, it can shallow our breathing. So we want to prevent pneumonia. So using an incentive spirometer is going to be helpful for that. So I encourage you to take this home and use it while you are taking pain medications. The last one on here are SCDs, or sequential compression devices. These are sleeves that are going to go on your calves and they will alternate. They'll pump air and put a little pressure on your calves. And it helps promote your circulation. So while you're in the operating room and until you're able to walk around afterwards, we want to prevent any kind of blood clots. And so this helps promote good circulation. I think they feel nice. They're a little leg massage. If you don't like them, the best way to get them off is to walk the hall 3-4 times a day. Early mobility is our other key principle of the ERAS program. A lot of good purpose behind here. It helps with your pain control after surgery. It helps increase your rate of healing, and it gets you out of the hospital sooner. So a lot of good benefits from moving around. Our mobility plan for you when you get to the floor, if you're staying the night in the hospital, is that you are moving at some capacity. Our goal is that you're walking around the day of your surgery, but this could be, just sitting on the side of the bed or getting up to your chair. So it is our goal that you are moving at some capacity. It's initiated by your nurse, the physical therapist, your CNA. We don't want you to be moving around on your own after surgery, but calling for help and get you moving. That will help with so many reasons to help your recovery. So the picture on the left is a sign that we have outside of your room. This is helpful kind of as a little checklist to make sure you're hitting all of your goals for after surgery. And so this can be filled out by your nurse or you or a family member. It's our goal for you that you are up in the chair for all of your meals, give you that sense of normalcy, help with your recovery. And it's more natural to be in a chair. And so instead of inclining your bed, sitting up in a chair will help with all of these good purposes of moving around. Walking the hall 3-4 times a day, super helpful, speed up that recovery. And then my little saying is, if you're moving your body, let's move your GI tract around as well. So using your sugar-free gum or hard candy to move and make sure everything is getting back to its normalcy after your procedure. This one, so being your best advocate. So if no one's told you, this is all about you. This is your time to be selfish. And so there's a lot of ways that you can be your best advocate and be an active participant in your care. The first one is when you're staying in the hospital, being up, eating breakfast before 7:30 so that you're ready for when physical therapy, occupational therapy, they start coming around in the morning. You are ready to go and help expedite that discharge process. Reducing your risk of falls, always important. You're going through all this hard work before surgery. We want you to be safe after surgery, so always call for help, making sure that you have that assistance so that you are safe. On all the hospitals in the rooms in the hospital, they say call, don't fall. That's our little saying. So making sure you're always calling for help, asking for pain medications. When you are in the hospital, all of those scheduled medications, so the Tylenol, muscle relaxers, those fun ones, those will be brought in around the clock. If you need anything stronger, like an opioid, you do have to ask your nurse for that one. They will not automatically bring that in. It's not that we are withholding the medications from you. We just want to see if the other medications are managing your pain before we try a narcotic. And then preventing infection, so always wash your hands. Make sure anyone else that's going to be messing with your incision is washing their hands. This is important so that they are not exposing any new bacteria to your site. No one will ever get mad at you if you ask them to wash your hands. And this is also for your caregiver at home if they're changing your dressing, looking at your incision, make sure that they're washing their hands as well. So preparing your home, these are a lot of things that you can start leading up to your spinal procedure. The first one is arranging commonly used items within easy reach so that you're not bending, lifting, or twisting to get to your items. So moving them onto a counter or off of in the cabinets, making sure that they are nice and accessible so that they are easy reach for after your procedure. Preparing meals ahead of time, this is helpful. The last thing you want to think about when you get home from the hospital is what you're having for dinner that night. And so utilizing frozen meals, DoorDash, Grubhub, family friends bringing in meals, this is helpful just to make that transition back home easier. Stocking up on food supplies, water, if you have any medications that are close to needing refills, this is helpful to have these all already ahead of time. So it's one less trip for you, one less trip for your caregiver. Preparing a safe environment. So making sure you have a clear path from all of the areas you're going to be recovering at home. So making sure you have a clear path from your bedroom to the bathroom, to the kitchen, to the living room, wherever you're lounging. And so making sure that there's no tripping hazards, no mats, rugs that are kind of slip, so that you are optimizing your safety. Arranging for any pet care for your animals. So have someone walk your dogs for the first couple weeks. We don't want you to pull. We don't want them to pull you and cause any injury to your surgical site. If you have cats, arranging for someone to help with the litter boxes so that you're not bending over to scoop that. And then arranging for transportation to and from surgery. So your post-operative appointment, any errands that you have, making sure you have good, reliable transportation. You will not be allowed to drive for at least those 2 weeks after surgery. And then plan on a 24/7 companion for the first 3 days after surgery. The first 3 days are typically when your pain could be at the highest, when you're really adjusting after surgery. So having someone there available for you is going to be helpful with that process. And if you don't have resources, we have some for you with our case managers in the hospital. So please let us know if you need some accommodations for how you're going to recover after surgery. So discharge instructions, you should have specific instructions when you're leaving the hospital. These are kind of just general instructions. And these are all on that first packet that we went over too. So this is just kind of going over it again, making sure that someone's looking at your incision using a mirror or using someone else if you're unable to see your incision, not putting anything on your incision, no oils, creams, lotions, ointments. If you have specific incision care by your doctor, then follow those ones. Don't submerge your incision. So again, no baths, hot tubs, pools, bodies of water. Our rule for showering is you can shower after you discharge, but if you have specific instructions by your doctor, then follow those. Deep breaths and coughs throughout the day. This is helpful to prevent pneumonia. So I encourage you to take that incentive spirometer home, making sure you're having those deep breaths and coughs. 3 meals a day with fruits, vegetables, whole grains, making sure you're getting all of your nutrients, utilizing that My Plate handout that I provided, and making sure you're drinking plenty of water. When you're taking pain medications, taking those stool softeners, and then your activity for when you're at home is just walking about 10 to 20 minutes a day, and increase as tolerated. So listening to your body, if taking it kind of one step at a time. Maybe a goal for you is to walk to the mailbox, and then next day, walking to the neighbor's house, or walking down the street, or walking around your house even is great. But walking is your main form of kind of recovery, your kind of exercise plan for after surgery. So post-op restrictions. So these are all things that we're going to talk about when you come into your post-op visit with your team. The driving restrictions, we'll talk about if you can resume driving yet, if you have any sitting restrictions, lifting restrictions. We want you to avoid sexual activity for 2 weeks, and then getting you enrolled with outpatient therapy. So getting you ready for your physical therapy appointments, your occupational therapy appointments, all of that good stuff. If you had a physical therapy appointment today, they should have gone over what's called the log roll technique. The log roll is how you're going to get safely in and out of bed while maintaining your spinal precautions. The log roll technique can feel a little foreign the first couple times that you do it, so I encourage you to go on YouTube, follow along with these pictures to make sure that you are a pro before surgery. So start practicing this beforehand. So it's going to make that transition for when you're home as easy as possible. So when you're laying down, you're going to bend your knees one at a time while keeping your shoulders aligned with your pelvis. So no twisting. You're going to roll onto your side. You will use your arms to push yourself off of the bed, and then you'll be in a sitting position. From there, you can go to a standing position. But I do encourage you to practice this so it's that much more natural for after your procedure. Is really important to help with your pain control after your surgery. If you had a cervical surgery or neck surgery, I would recommend placing pillows under your arms while you're sitting down to help take the weight and the strain off of your muscles. Your body will start to strain your muscles if they can't relax, which can increase your pain. And so really optimizing your comfort level and taking the pressure off of your surgical area is super important. To support your back, you can place a pillow behind you to prevent from slouching. The picture on the bottom left is an ideal sleeping position when you're on your side, having those pillows to support your arms, support your legs, ideally having a pillow behind your back as well. This will help take the most amount of weight and tension off of your spine, and that's going to be very comfortable after surgery. The picture in the middle is someone laying on their back after surgery. And so when we lay down, our spine has a natural curvature to it. And so by placing a pillow underneath our knees, it helps flatten out that curvature and it helps take some tension, especially off of our lower back. So it's an easy way to help optimize your comfort is just by putting a pillow underneath your knees. The picture on the right is someone with a pillow underneath their hip, one of their hips. This is helpful. You're still maintaining your spinal precautions, but you can help kind of distribute some of that pressure off of your spine, kind of laying a little bit sideways will be helpful to optimize your comfort after your procedure. ADL modifications. So ADL stands for Activities of Daily Living. So these are things that you do every day, probably without even thinking about. And so when you're sitting down, I don't know about you, but I tend to kind of slouch over. And so by putting a pillow like right above our hip bones, it helps kind of force a little straighter of a posture. And then this is going to be really comfortable after surgery. The picture on the top is someone brushing their teeth. And so how you will safely do this without bending over to spit your toothpaste in the sink is one of our occupational therapists recommended bringing 2 cups into the bathroom with you. So one that you will drink your water out of and then another one that you'll spit your toothpaste into. That way you're not bending over in the sink at all. So I think that's an ingenious way so that you can still do the things that you do every day, but make sure you're doing them safely after your procedure. Picture on the bottom is someone reaching for a bottom shelf item in their fridge. This person can set themselves up, move those items a little bit higher so you're not bending. But if you do have to bend down, if you do have to pick something off of the floor, instead of bending with your back, do more of a squat with your legs. So you can see this person, their back is perfectly straight. They're just using their legs to bend down to pick up that lower shelf item. The picture on the right is someone putting on their pants. This is how you'll do it after surgery, is when you're already in a sitting position, get everything prepped. So put on your underwear, your pants, your socks, your shoes, everything while you're sitting down. So that way, when you stand up, all you have to do is slip them on. And you're not bending over to try to put on those garments. If you don't already have the My Centura or the My Common Spirit app, make sure you get this downloaded. This is a great tool to make sure you're up to date with your test results, your appointments, your prescriptions. And then we also like to use the portal for how you talk to your surgical team if you're having any of those questions or concerns after surgery. If you don't have this downloaded, get this downloaded. It's a great tool to make sure you're up to date with everything. The number on here is a helpful to get logged in. We can also send you a link over here. So either way, we want to make sure that you're up to date with everything going on. And last but not least, thank you for choosing Neurosurgery One, a Common Health Spirit clinic. We are so happy to help get you educated before your spinal procedure, and we're happy to help with anything that you need along this progress to make sure you have a good outcome after surgery. If you have any questions, give our office number a call. We're happy to answer any of those questions, and we wish you the best of luck in your spinal procedure. Thank you so much.